In the wake of Orlando, as we have been talking the past couple of weeks about gun control, it occurs to me that what has been absent from the public debate that unfortunately or fortunately came out prior to Orlando, but has sort of dwarfed Orlando, is no public discussion about what has once again been shown to be the third leading cause of death in the United States, behind heart disease and cancer. Let me first tell you what it isn't. It isn't motor vehicle accidents, 34,000 a year. It is not firearm violence at 34,000. It is not suicide at 41,000. It is not COPD at 149,000. The third leading cause of death in the United States is medical errors at 251,000 a year. Researchers at Johns Hopkins, updating studies that had been done in the late 90s, published in May of 2016 in the BMJ, British Medical Journal, that using an incredibly conservative definition of what constitutes medical errors, stated that the number of 250,000 was conservative of the number of deaths a year that were caused by medical errors. Yet pointed out that despite it being the third leading cause of death, the CDC doesn't currently provide to medical examiners a code that they may use for human errors that cause or contribute to death for them to place on a death certificate. What that creates, as the principal researcher at Johns Hopkins pointed out, was obviously an underappreciation of deaths being caused by medical errors and an overappreciation of deaths being caused by heart disease, cancer, gun violence, etc. Because that data is collected and published, and data pertaining to medical errors isn't. What's strange to me is that the amount of money that we spend every year, the amount of public debate that we have every year about heart disease, about cancer. Right now, as I'm filming this, we're having a national debate about gun control. And I bet today on none of the national television stations or cable outlets will there be a single discussion about the third leading cause of death in the United States. Not one. Much less any money spent. I mean, do you know of an organization, have you attended a black tie event where we raised $3 million towards research to reduce medical errors? Well, I mean, the American Heart Association, American Cancer Association, and other organizations affiliated with them raised this week alone across the United States, raised millions of dollars with research or for research to be devoted towards that issue. What's clear to me, though, is that there's got to be a better way of collecting data, permitting medical examiners to check a box at the time that they're conducting an autopsy, to confirm if they may, on the basis of the information that they've collected at that point, whether medical errors played a role in that death. Now, will that happen? Well, the debate so far is that it's a lot to ask a medical examiner to, at that point in time, be placed on the spot to state and point a finger at a fellow healthcare professional as to whether he or she contributed to the death of the person that they're conducting an autopsy on. Now, I can only tell you that from my experience in dealing with medical examiners, if they're given all of the information, and all of the information requires that they modify their death certificate in some fashion, and even if that modification implicates a healthcare professional, generally speaking, I have found medical examiners willing to do that, because they understand the importance of the work that they are doing, not only with respect to the individual upon whom they're performing an autopsy, but they understand for public health purposes the purposes of what they're doing. But the point is that medical examiners would certainly have to be given all of the information, but this idea of permitting them to check a box is simply to enable medical examiners to look at that issue as to whether that issue or medical errors contributed to the cause of death. Because what will happen is that medical errors then will continue to be underreported. Name me a person that you know that has died in a hospital in your area that you know of that died because of a medical error. You may not know of anybody. And the reason you don't know about it is because it's not reported. Lawsuits. 90% of every of all the medical malpractice cases in the U.S. that are filed, they are either dismissed or they are resolved, settled, without the case making their way into the courtroom. If they're dismissed or if they're resolved, certainly if they're resolved, there's this confidentiality provision that prevents the patient, prevents the lawyer from discussing anything that happened with respect to the case. Yes, there are indeed some physicians that either must self-report or are reported by reason of any settlement of any medical malpractice lawsuit. But all of the proceedings, most of the proceedings conducted by licensure boards of healthcare professionals across the country are confidential also. So unless we find a way of collecting data regarding medical errors being a cause of death, this issue will continue to be underreported. And accordingly, for those 10% of the cases that make their way into the courtroom, jurors will continue to be ignorant in an academic sense about medical errors. No lawyer defending a medical malpractice case is going to leave a juror on the jury who has had some personal experience with medical errors causing injury or death to a family member, a friend, a close associate. So unless the public is educated about this issue, independent of what personal experience that they've had, then the public will continue to be ignorant. If you ask 12 out of 12 jurors, how many of you believe that heart disease is a leading cause of death in the country? They'd throw their hand up. Similarly with cancer. Motor vehicle accidents. How many of you believe that motor vehicle accidents are a leading cause of death? And you skipped right over the third one. If you ask the question, how many of you believe that medical errors are a leading cause of death in the United States? Most of them would keep their hands in their lap. They would not know. They don't know because it is not a statistic that is recorded and it is not a statistic that's reported. Now, education, as we have, I think, seen as a country, typically brings about change. Lawmakers would have to be a part of that change. We've certainly seen that lawmakers have had no problems at all enacting these one-size-fits-all tort reform measures, placing arbitrary caps on the amount of money that you can recover in a medical malpractice case. Surely, proper education of lawmakers about this issue would enable lawmakers to make a common sense decision about whether medical examiners have one more box among many boxes that they're required to check as to whether or not medical errors played a role in a patient's death. Now, certainly with the amount of time, effort, money, emotion that we spend on the first and second leading causes of death, surely we can spend just a little bit of that towards the third leading cause of death. If we do that, then I'm convinced that independent of what I do for the clients that we represent, we'll reduce deaths and injuries from medical errors, which is certainly a goal of what we do here. Our goals are bigger than necessarily just representing the people that are victims or their families that are victims of medical errors that result in deaths. We do this for hopefully in an effort to reduce the number of medical errors that are made.